I'm very angry.
What's your story?
I am very angry. I'm more angrier this morning. People are dying each day. The dialysis machine in Kolebu got...
Voice of activist Nasiba Bauer at a protest demanding a reduction in the cost of dialysis treatment after the Kolebu Teaching Hospital increased the cost from 380 cedis to 765 Ghana cedis. The amount has since been reversed. It triggered the Dialysis Crisis series on Joy News, highlighting the plight of 54-year-old Georgina Pia who couldn't afford the cost of dialysis. 15-year-old Priscilla Sante, who died some hours after she was featured in the series, pleading for assistance with her dialysis treatment. Some patients with kidney failure held a press conference and said 14 of their members have died between May and September after the Kolebu Teaching Hospital limited its dialysis treatment to just emergency cases. The hospital said it had run out of consumables. The renal patients who said they were being sponsored were now compelled to pay for dialysis treatment in other facilities. Speaking during the stakeholders event held in the studios of Joy, Chief Executive Officer of the Kolebu Teaching Hospital, Dr. Opoku Wariampoma, said the decision was taken because the Kolebu Teaching Hospital renal unit is suffocating under a 4 million Ghana cedis debt. He is unsure when the services will be made available to outpatients. He says the facility will also need 961,000 Ghana cedis monthly to keep the cost of dialysis at 380 Ghana cedis.
We are now engaged with government, with the ministry, with other stakeholders to see how quickly we can, find the resources to advance. Because at the moment we are sitting in a 4 million cedi hole. If we are to operate at our current capacity, which is about 2,000 dialysis sessions every month, then it means that we are going to accumulate about 961,000 cedis of debt every month, in addition to the 4 million cedis that we have already. So this is financially unsustainable.
You can't tell when exactly the OPD will be opened.
Yes, exactly.
You can't tell.
I can't. Yes.
Okay.
So it's 4 million. We have a 4 million deficit.
Okay.
And then if you are to run at full capacity, we will need about 961,000 cedis subsidy every month to be able to maintain the current prices.
Presidential Advisor on Health, Dr. Anthony Nsiansari, says steps have been taken to settle the debt.
We are waiting for what they are supposed to bring and then to be worked on as quickly as possible. The money is supposed to be provided by the Ministry of Finance, isn't it?
Yes. Okay.
So Dr. Mpoma has to put everything that he is doing, that is being asked to do, as quickly as possible in place. If I were him, I would use 24 hours to put everything in place and present it. Yeah, so they'll present it.
We've already presented.
And
no, you're free to talk because this is direct.
I've told him what to do.
Yeah.
And then quickly, I'm sure I know what normally such things are very dear to the heart of the authorities, and it will be done.
Kidney failure patient Kojo Bafwahinkra says most of his colleagues feel they are a burden on society, with friends deliberately not answering their calls.
Now we are becoming a burden to the society. You pick a phone, you want to call your friend. He knows you are coming to ask for money, so you will not even pick.
Wow.
You pick a phone, maybe you want to say hello, maybe there's an information you are trying to ask him. He will not even answer it. Later on, he will call back and say, oh, child, I saw your call, now this Samuel. It's not true. Because he knows you are coming to ask money. And it's true. When you call the person, it's money.
President of the Ghana Kidney Association, Professor Samson Enchi, says all children with end-stage kidney in Ghana die. He says immediate dialogue and action is needed to make dialysis accessible and affordable to all.
When it comes to children, it's pathetic because we don't have any facility for children. And where I practice, for all these years, any child who gets to the end-stage kidney disease dies. And the number is quite huge. But there are many more who also pass in our health facilities. All the children die, and many adults can also initiate it. So the single problem has been the cost of treating kidney failure. It is so expensive that we should not allow people to pay out of their pockets. What we see in Confanoche, take note of this statistics, is quite startling statistics. We see every year between 25 to 40 children who come with end-stage kidney disease, and they will all die because of course, we don't even talk about initiating chronic dialysis.
Former General Secretary of the Ghana Medical Association, Dr. Titus Bayu, wants dialysis treatment to be made free.
If we are looking at it, I think ultimately dialysis must be free. And we have to have a funding mechanism. My other submission on this is that if you look at the kidney situation we are discussing, the prevalence of chronic kidney disease, about 17% in Ghana, means that this condition is even more prevalent than HIV. Has it gotten the needed attention like HIV? So we need perhaps a separate entity, maybe a National Kidney Health Authority or a chronic diseases or non-communicable diseases authority to engage in surveillance for these conditions, proper research on the etiology.
Director of Corporate Affairs at the National Health Insurance Authority, Oswald Mensah, says the NHIA has set up a committee to review and assess whether the NHIS can absorb the cost of dialysis after Joy FM's Dialysis Crisis series.
As it stands today, there's conversations, and this has started, of course, based on your documentary. Even at the NHIA level, the board is discussing, there's a committee that has been set up to have these conversations about dialysis, its implications, if NHIA can do anything about it, and most importantly, make recommendations for the policymakers. And I'm happy Senior says there's a lot happening in that space. The Ministry of Health drives policy in our landscape. So whatever recommendations that the board will come up with will be passed on to the ministry and the policymakers for a direction on where we...
Did you say that a committee has now been set up to review and consider whether you can afford to take the dialysis cost? Is that what it is?
Yes. Okay. Before NHIA can take on any disease condition, we must do actual studies.
Presidential Advisor on Health, Dr. Anthony Siasari, revealed the process to make kidney transplant available in Ghana is underway, with a document being reviewed for a law on the harvesting, storage and donation of organs.
There's a document which is being reviewed so that we have a law. It's very, very important. It has to go through cabinet for cabinet approval and then move to parliament for parliamentary approval, and the president will assent to it, so that we can harvest the organ, we can store the organ, and also donate the organ. It's not only for kidney, because even for the in vitro fertilization that they are doing, it's a tissue. Skin from other person to another person is a tissue. So all these things should be backed by law. And that is what is going on. And as I said, I'm very key, he is very key, everybody is key. The Ghana Kidney Association, the Ghana Ophthalmological Association, and then even the Plastic Surgery Association and the IVF team are all on us, and some of us have taken up as our, because I'm a doctor, first and foremost, that this thing should be done and done as quickly as possible. And then, as he rightly, as the Dr. Ampuma said also, we are building the capacity of our surgeons. Actually, kidney transplant is one of the most not so complicated things that we can do, as any surgeon can do. And we know that there's also a urology unit which is almost completed at Kolebu. It will be part of the place where we can have also renal transplant done, and to train our doctors and our nurses and all the health workers to go into that type of field. We are working on that. I know that there's a document which is being looked at the moment